Welcome to the Generous Benefits Podcast, where we talk about building benefits that actually help people and still make business sense. I'm your host, Amanda Brummitt. Today, we're talking about something that affects every benefit plan and every plan member, pharmacy experience. Pharmacy, prescriptions, and the cost and complexity tied to them is one of the biggest frustration points in benefits for employees, for HR teams, and for employers trying to manage cost and care. Our guest today is Sachie Stover, Chief Customer Officer at HaloScrips. HaloScrips is focused on improving pharmacy benefits and member experience by creating a more transparent, efficient, and supportive pharmacy process. We're going to talk about the traditional pharmacy model and where it falls short, and then how HaloScrips helps fill those gaps, what employers often misunderstand, and what practical steps an employer can take to improve the pharmacy experience today. Let's jump in. Well, Sachie, thank you so much for being here today. It is such a joy to get to start the morning with your face and your voice. And anybody that knows me, and we've talked healthcare, they know I love my HaloScrips and they know I love my DPC. So we're going to talk about 50% of it today. Perfect. Can we start with just tell people who you are? Not about HaloScrips yet, but who are you? What's your background? How'd you get here?
Yeah, so my name is Sachie Stover. I'm a CPHT. I have been working for HaloScrips about 9 years.
And a CPHT means that Sachie is a certified pharmacy tech.
I started with a different part of a sister company of ours with Good Shepherd Pharmacy, and it was a nonprofit pharmacy that kind of grew into HaloScrips. Evolved over the years. We've seen we could help people with low income or uninsured individuals. And then we also saw there was need in kind of the employer world and employee benefits. So it grew over time. But yeah, I've been with the company about 9 years and loving every moment of it. So I serve as the Chief People Officer with HaloScrips. My role kind of sits at the intersection, I would say, with patients / people, care delivery, and operations. I really focus on building systems and teams that make the medication management kind of feel human again and homey for plan members who rely on their medications every day, and also serve those employers who are trying to do, the right thing with pharmacy world without getting too buried in all the complexity of it.
Yeah, and you do it very, very well. I can't tell you how often I'm actually just going to email Sachie, call Sachie. Let me get the answer to this.
Email me anytime.
Yes, and she will answer anytime, even though you shouldn't. We did a show. We did a show with Phil on Good Shepherd Pharmacy maybe a year or so ago that I'll link to in the show notes. But just so our listeners know, Good Shepherd Pharmacy is a nonprofit entity. They serve people. They deliver meds to people that can't afford them. And drumroll, HaloScrips is one of the funding sources. So we're here to talk about HaloScrips today because you're good for employers, but you're also funding a really, really important thing in Tennessee and beyond. Okay, so let's dive into first what employers are facing. What are the challenges that employers face with traditional pharmacy and that traditional pharmacy experience?
I would say if there's just a big misalignment. PBMs tend to be financially incentivized by drug price inflation, spread pricing, rebate structures that kind of rewards opacity versus the outcomes.
And a PBM is a pharmacy benefits manager.
Employers think they have to buy into this benefit, but they really buy in a mystery box, a black box, as you will. And their employees will feel that too. Their members feel that too. Very confusing formularies, surprise copays, pharmacy switches, no one who actually knows them and their medication history. I would say that causes frustration, waste, and poor health outcomes, even when the employer's probably spending a hefty penny on it.
Definitely. And okay, we understand the challenges now. I mean, going to a big box pharmacy, while sometimes necessary, it stinks as a patient. I hate it when I have to get something not at HaloScrips. So explain to us what HaloScrips does to make that pharmacy experience better for the employer, but also for the employee.
Yeah. So we separate the medication from the service. So on the employer side, the employers know exactly what the drug cost is, exactly what our service cost is, and exactly what they're going to get in return. The members, we're separating the members, the employers are taking care of all that on that side. The members will get that one-on-one pharmacy relationship. They'll have a constant care team, a proactive experience. We don't wait to see things on claims or reports, as, they will on the employer side. We manage the medications and the patients long term. So we have that communication, kind of that trust meeting you talked about. So our pharmacists and technicians really get to know each individual member, their conditions, and their goals to service them better.
And then do you want to explain the pharmacy sync and how that helps you guys keep costs lower?
Yeah. So the synchronization process, HaloScrips, group synchronization. So we line all their chronic medications for the patients to a single quarterly predictable refill date. The patient or member, is well aware about. So we have that auto refilled, one shipment, one touch point. So we're sending out and fulfilling exactly what's needed for each patient. From a pharmacy standpoint, that definitely reduces waste in emergency fills because we're being proactive again on the front end and sending it to each individual member. For the member standpoint, I would say if I could give a suggestion would be like we're doing that work for them. They just sit back and they get to relax and their shipment shows up on time with them still having plenty on hand.
Yeah, definitely. And I'll offer a couple of personal examples, both from the employer and employee side, if it's helpful. And is one on the employer end, it's awesome because I get one invoice per month. I was able to set up the parameters about the different price points and things like that. And so I pay one bill a month, and it's generally pretty close to the same amount, unless something funky comes through, which is funky on our end, not HaloScripts end. So it helps take that variability out for me. And then as a member, it's great because I never have to have the stressful run to, 2 o'clock because they close from 1:30 to 2. Make sure to grab my prescription. But also one thing that I was really impressed by and that I felt like you guys really did an amazing job with is I had a $600 a month or $600 a month PRN capsule, PRN meaning as needed, that sometimes was hard to get and hard to find. And you all were able to switch it to a tablet and saved tons of money for generous benefits. And for me, for the patient, it was even better because I could take half the dose. Yeah, so I feel like the downstream effects are really, really positive for the person, but also just make it so much easier for the employer. So thanks. I love your syncing. And then you mentioned when you talked about pharmacy benefit managers, you mentioned spread pricing, hidden rebates. There's a lot of yucky stuff that goes on in pharmacy world. Well, now I feel like I've set you up to only answer it one way since I called it yucky. But does HaloScripts do any of that stuff?
No, we stay away from the yucky PPM stuff. So there's no spread pricings with HaloScripts. There's no hidden rebates, no games at all. HaloScripts doesn't profit from higher drug prices. If there's manager rebates for the employer, we're fully transparent and we pass that through according to each employer's individual plan. Our incentives are to align with lower total costs and improving outcomes and not inflating those claims that you might see on the PBM side.
Amazing. Yeah. And I can testify that I see a spreadsheet every month with all the columns and exactly what it looks like.
Lay it right all out on that Excel sheet.
Exactly, which I love.
So organized.
Yes, yes. And then in addition to the cost savings and transparency, you mentioned medication adherence. Do you feel like it really changes people's ability to stay on their meds, take their meds right?
Yeah, so we really strive in the medication management adherence. It's one of the biggest areas we see the impact. members aren't dealing with like refill chaos, as you explained, maybe with other pharmacies, those high costs or surprise costs, conflicting instructions from pharmacy 1 to pharmacy 2 or pharmacy 3. And the MedSync automatically adherence improves members in taking their medications just naturally because it shows
Yeah.
up and they're not worrying about costs and they're not worrying about getting to the pharmacy, like you said, certain times. So our pharmacists are totally accessible. Again, they're proactive and intervene pretty early on in taking any new medication or medication changes. We address all side effects. We identify all the drug interactions. We coordinate with all their prescribers. So whether they have one doctor, 6 doctors, we work and as a team with them. And it's totally constant, not off and on. Like you said, email us, text us, call us. We're here. And I think that improves that adherence tremendously.
Yeah. And what does that look like? So if somebody has a question, do they call in? You talk to the pharmacist for them? Do they talk to the pharmacist? How does that work?
Yeah, so a patient, we know what's most convenient for them. Typically, it's a phone call. May start out with the email or end with the phone call. I address their concerns and I get a list of what that might be, all their medications. And then again, yes, if it's a definitely a pharmacist needed answer, I pass that information along and connect them. If it's something that I can do as a technician, obviously I'll follow right then and there. But yes, I gather all the information that's needed to kind of get that background for the pharmacist and then to connect with the patient so they're, troubleshooting what that issue might be at that time.
Yeah. And how often do you find that they're on medications that are contraindicated or doses that might have been like a miswrite or how often are there errors?
I don't see a lot of errors on our they happen in the pharmacy world. There's audits, there's things that can happen. Scripts may come over from a doctor's office and it's not legible. So, again, we do work proactive. We're going to call them. We're not going to it's not a guessing game. Some of them are handwritten. Some can come over electronically. Again, just data entry error. But we're going to, again, make that connection, say, hey, you were in the doctor's office with your doctor today. What was new? What changed? What did y'all talk about? We might have received this prescription. Thank you for that information. We're going to follow up with your doctor now and see what the differences are and make sure that, again, we're providing that best customer service and exactly what that patient needs at that time.
Yeah, I mean, talk about medication adherence improvement instead of it then sitting for 3 days in a queue and yeah, you just pick up the phone and call and fix it.
Yeah, exactly.
It's funny because I feel like your medication syncing is very, very high tech, very, logistics, well thought out, but then we almost need to be low tech when it comes to the customer service piece of it and just pick up the phone, figure it out.
Yeah, yeah. Sometimes we just go back to old school ways.
Yep. Are there misconceptions you think that employers have about pharmacy benefits or even pharmacy vendors?
I would say so. Misconception is pharmacy vendors are interchangeable and that they're going to lower prices automatically, meaning lowering the total cost. But in reality, it's poor experience.
Yeah.
Just kind of how we just talked about. So poor experience actually drives that non-adherence. The non-adherence drives the complications, and then the complications drive claims everywhere in the system, medically,
Yeah.
pharmacy, and all those have to kind of interline, like you said. Those conversations have to be had.
Hmm.
Uh, those audits need to happen. Another misconception is that transparency is just about reporting. True transparency changes incentives and behavior. So just like you said, laying it all out there and making the best decision. Be total transparent prices, service.
Yeah, that's a good point. Are there certain disease states like, I don't know, congestive heart failure or diabetes where you feel like your model really shines in helping people to take all their medications and then prevent those big events from happening?
So usually what we suggest in like taking those actions and being more proactive is we tell employers pick like just a high volume chronic class medication, like you said, diabetes, hypertension, cholesterol, demand true cost plus pricing with the pharmacist's oversight.
Mm-hmm.
I think that's where we benefit. Yes, you see, we're giving you true transparency on everything, but actually have pharmacists over that. So we can talk about the diabetes, the hypertension, the cholesterol to be proactive on it. Not just picking cheaper pills, but a better process. So synchronizing them, pharmacy check-ins, a clear accountability.
Nice. Yeah, I appreciate that a lot. And I also appreciate what you said about it's not necessarily going to take the actual prescription pricing down necessarily. It may be just an overall improved experience, improved health, which then does reduce those downstream claims for sure.
Adherence, maybe less visits to the doctor's office, avoid trips to the ER. It's just a big cycle.
And then, Sachie, as a pharmacy tech, is there one thing you wish every person knew about prescriptions?
Yes. Problems are not caused by bad patients or non-compliance. They're caused by systems that are hard to navigate, stressful, and not truly designed with the patient in mind. So covering all the great questions that you had today, covering all that is fixing the system, doing the right thing so you can help your employers, your patients, and helping that adherence.
Well, this has all been such good information. Is there anything I didn't cover? Anything you want to make sure employers or employees know?
No, this has been perfect and helpful, and I'm super excited, and I'm glad we did this.
Awesome. Well, thank you for your time today, and thank you for making a great experience for Generous Benefits employees and for us as an employer.
You're very welcome.
That was Sachie Stover with HaloScrips. Here's the bottom line. Pharmacy benefits touch every employee, and traditional approaches can leave people confused, frustrated, and paying more than they should. By prioritizing transparency, service, and smarter engagement at the point of pharmacy care, employers can elevate the experience, improve outcomes for their workforce, and potentially control costs. If today's conversation made you think differently about pharmacy, or you want to explore smarter ways to support your members, that is a great next step. Thanks for listening.